Hello everyone. So today we are going to do spleen. Spleen is mostly asked for in Viva. Sorry. Moving on. Introduction. It is a wedge-shaped organ lying mainly in the left hypochondrium and partly in the epigastrium. So I hope you know the 9 parts of the abdomen. Soft, highly vascular, dark purple, present between the fundus of the stomach and diaphragm. Largest lymphoid organ in the body. The functions of spleen are: it is going to filter blood by removing the worn out RBC, manufacture RBC in fetal life and lymphocytes after the birth, provide immunity, store RBC and release them in circulation when required. Coming to the measurement, this is very important. This is really very important. The odd pattern, that is Harris dictum. So the thickness is 1 inch, the breadth is 3 inches and the length is 5 inches. The weight is 7 ounces and spleen is related to the 9th, 10th and the 11th ribs. So you just remember it in the form of the odd numbers 1, 3, 5, 7, 9 and 10, 11 you remember in a sequence after 9. Coming to the external features, we have two angles. We have anterobasal angle, that is the junction between the superior border with anterior end. It is a clinical angle. This is also important. It is a clinical angle as it can be felt when the spleen is enlarged, when you have splenomegaly. Posterobasal angle at the junction of the inferior border with the anterior end. So we have two, anterobasal angle and posterobasal angle. So anterobasal angle is with superior border and anterior end. Superior border and anterior end. So this is the anterobasal angle. Okay, this is the anterobasal angle with the superior border and the anterior end. And then we have the posterobasal angle at the junction of inferior border and anterior end. Inferior border and anterior end. So this is the posterobasal angle. Okay. Now we have got two ends. Anterior end is expanded and more like a border directed downwards and forwards. Posterior end is rounded, directed upwards, backwards and medially, related to the upper lobe of the left kidney. So now this is the posterior end and this is the anterior end. As you can see, the anterior end, okay. As you can see here, the anterior end is more like a border, whereas the posterior end is a little pointed, and above the posterior end you are going to find the kidney. Okay, now coming to the three borders, we have superior border that has got notched surface. It is basically notched. These notches, they are going to signify, these notches that you can see here, this signifies that it is the superior border. Then coming to the intermediate, it is rounded, separates the gastric impression from the renal impression on the visceral surface. Inferior is rounded. Now we have two surfaces. We have a visceral surface that is concave, irregular, gastric, colic, renal and pancreatic impressions are present here. So this is, as you can see in the diagram, this is the visceral surface. And diaphragmatic surface is convex, smooth, related to the diaphragm that separates the spleen from the costodiaphragmatic recess of pleura, lung, 10th, 11th and 12th ribs of the left side. Okay, so this is the diaphragmatic surface. See, now it is related to the diaphragm that separates the spleen. You have to remember this, okay? That it is separating the spleen from the costodiaphragmatic recess of pleura, lung and these three ribs on the left side. Moving on, coming to the relations, we have peritoneal relations and the visceral relations. We will do the visceral relations first. Gastric impression for the fundus of the stomach. Renal impression for the left kidney. Colic impression for the splenic flexure of the colon occupies a triangular area adjoining the anterior end of the spleen. Pancreatic impression for the tail of pancreas. Then coming to the peritoneal relation. The spleen is completely enclosed in the peritoneum except the hilum. Peritoneum is going to cover your spleen entirely except at the hilum, that is the opening point. Now gastrosplenic ligament, important again. It extends from the hilum of the spleen to the greater curvature of the stomach. Leno-renal ligament. It extends from the hilum to the anterior surface of the left kidney. The word suggests renal related to kidney. The word suggests gastrosplenic related to stomach. Even if you don't remember greater curvature of the stomach, at least remember stomach. That it is going to go from the hilum to the stomach. Remember that again, leno-renal ligament is going to go from the hilum to the left kidney. At least remember this much, even if you don't remember anterior surface. So phrenico-colic ligament is not attached to the spleen, but it supports the anterior end. Okay, now coming to the arterial supply is the splenic artery, the largest branch of the celiac trunk. Coming to the venous drainage, splenic vein. Lymphatics is periatriolar lymphoid sheath in white pulp. No lymphatic vessel in the red pulp. This is important, like you should know this thing. You should know this. It is generic and important. Nerve supply, sympathetic fibers, celiac plexus. Now coming to the applied anatomy, which is also important. Abnormal spleen is not palpable, only palpable after it has enlarged double its normal size. So splenomegaly is enlargement of the spleen. Splenectomy is surgical removal. Care sign. So now this is very important, I'll say, and mostly it is asked in vivas. So you should know this. Classical symptom of ruptured spleen, it is the occurrence of acute pain in the tip of the shoulder due to the presence of blood in the peritoneal cavity. So, see, remember, like the K tells you, as you can see this black diagram over here, you have to remember this. There is bleeding in your abdominal cavity. So the possible cause, because there is rupture in your spleen. And what is the sign and symptom of this? Same is that there's gonna be pain in your left shoulder. There's gonna be pain in your left shoulder. So remember it as K. Okay, so I hope you have understood spleen. Thank you so much. Bye bye.